Dr. Ourian is with us. Here's the lovely Elizabeth, who's, you look pretty good, I have to tell you that. Okay, all right.
We're all very curious about this.
All right.
Yes.
So what will you do here? What will you accomplish?
Well, what we're going to have, Elizabeth has a little bit of a, what she complained about, a little bit of a jowling here on her neck and here. And she also has some lines that are the nasolabial lines and the bags under the eyes. She also has a little bit of a frown line, and we're going to use the ultrasound and the radio frequency technology to lift her eyebrows up, get rid of the bags. We're going to add a little bit of volume under the eyes to get rid of the hollowness. We're going to get rid of the hollowness here, and we're going to do the ultrasound to tighten the neck up. So overall, lift everything up without using any knife.
How long does this take to do?
Well, normally an hour and a half, but here in the studio, we're going to do it in 45 minutes.
Okay.
I like that.
And how long does it last?
The results last anywhere from 2 to 3 years, so
Okay.
it could be
And
quite
how about
lasting.
price?
The price is anywhere from $1,000 to $3,000, depending on the person who wants to have the.
And if you were cutting, it lasts longer, but it's much more expensive, and it's a much more extensive
Yeah.
Absolutely, and a
procedure.
lot more risks involved, and she would be completely out.
So lasers, injections,
And ultrasound.
and ultrasound.
Yes, nothing with the scalpel.
So what will you start with right now?
We're going to start with the ultrasound first, which we are ready to do, and it's really going to be like she's not going to even feel anything as we do this. It's going to be a little bit of
there's a little shot there.
it's a little bit of
I
warm.
jumped.
Is it warm?
So it's just a little mini ultrasound wand.
Can she speak? Or
Yeah, you can go ahead and talk. Go ahead and talk.
you want to talk?
Oh, sure.
How does it feel?
Oh, it feels fine.
Really? Just
It's-
that first little.
Well, no, the first one just startled me. I didn't realize we were starting.
So what are you really hoping that you'll accomplish today with this?
Oh, just to have a, you know, sort of a refreshed look and not look as tired. Kind of a tightening, I guess.
It's a nice option that you don't have to do the cutting and the...
It's really amazing. In the
Scalpel.
past, really, probably 4 or 5 years, new technologies have come around that helps us be able to do procedures similar to this, and without having to get a facelift. And patients are really happy. They can go back to work the next day without having to have a lot of swelling. And I think Elizabeth, if you're lucky, she's not going to have any bruising today, and she's going to be able to go back to work today.
And when will she see the full effect? Does it happen
The
a
final
week
results
later?
is actually going to be in 6 weeks, but we'll be able to see some results today.
Okay.
In 6 weeks.
In 6 weeks is the final result, but you will be able to see really the at least 50% of the results today.
All right, so we will be able to show a before and after
Absolutely.
and
And
see
we'll
clearly.
see something.
Yes, she's going to look fantastic, right?
Yes.
Yes.
And do you work with the doctor, or you just came in?
Yes.
Just
yes,
to the
working
show
with the
today. You do
doctor.
work with the
Been here.
doctor, okay.
Yes.
And a good candidate, again, you said, is between the ages of 30 and 55.
To 55 is a person who's really not, doesn't have a lot of sagging, maybe they want to look 5 to 10 years younger than they do now. And the concept is to tighten the skin, tighten the fat and the muscles underneath, and lift the
It's a
eyebrows.
little pick-me-up.
Yes.
Okay.
And it's better than any other surgery.
Here's what we're going to do, Doctor and Elizabeth. We're going to continue this through, and we'll take pictures of it as we go on. You'll see it, and then we'll see the finished product. So you're getting all your surgery done here in our operatory.
The
It's a large
non-surgery
one.
surgery.
Yeah,
Yes.
it's a large one here. Okay.
We're back.
All right, here's the before. If you were watching earlier, you saw Elizabeth, and
About an
she's
hour ago.
undergoing the laser lift, I guess you would call it, with Dr. Ourian. And so that's how she looked before, and this is how she looks right now. Pretty good there.
There is definitely a difference.
You can see
Especially
the
in the
jawline
eyes.
here,
Yeah.
and the eye. Look at the jawline. She is like nice straight jawline. She used to have a. I don't know if you have a before picture from the profile. She had jowls here, and the eyebrows are lifted.
Wow.
And
Well,
under
and
the
it'll
eyes,
stay.
the back,
It'll
and they
stay.
stay. It'll stay for at least a year to 3
In fact,
years.
you say the best results she'll see in about 6
in
weeks.
6 weeks and it continues to get better. As the collagen starts to tighten up, she's going to get even more of a lift around the forehead and more of a lift around the eyes. She has no lines around the eyes right now, and the jawline looks nice and
Wow.
straight.
How does your face feel?
Oh my, it feels wonderful.
Does it feel tight?
Does it feel tight? Does
Tight.
it feel like if
Tight
you,
is good.
If you
It does.
smile, it'll break?
No,
No, it doesn't feel like that.
No,
Did
not
it
too
hurt?
tight.
It didn't. I mean, it's a little warm, but not uncomfortable.
Now, did you numb her at all?
We numbed her with numbing cream. The whole area was numbed with numbing cream, and then
Not,
we did
not shots? Or
no, not shots, but then we added a little bit of the filler around the cheeks here to lift this up as well, and then we did the whole ultrasound for the full face. So
So when you say filler, you mean like Juvederm?
Juvederm or radius,
Okay,
yeah.
all right.
and
I'm
that's
getting to
it.
know this stuff here.
You're getting to know this
Yes.
stuff. Well,
Yeah.
And so again,
Steve
how
is going
much
to be our
is-
next consultant.
Are you going to go
Okay,
next?
the next victim, the
Yeah.
next client.
How much again?
The price is around anywhere from $1,000 to $3,000-$4,000, depending on what
Depending
you
on
want to
how
have
much
done
you
and
need to have
what you
done.
need to have done. In Elizabeth's case, she had just a little bit of a jowling and a little bit of a extra double chin here.
I really do
You don't
see
have any
nice.
more,
a
you don't have any more
difference.
jowls. Okay.
And it has really tightened up the
And
eyes.
obviously the redness will.
The redness will subside.
away.
She's right out of the oven right now. It's
Right
gonna
out of the
take-
Right out of the
It's
oven.
going to
So you
take
could actually go to work the following day?
the
after
same day
something like
even.
this?
If she
Same
can, she
day?
can put makeup on and go back to work. Not a problem at all.
Okay.
But most likely,
take the day off.
take the day off.
Okay, would you please?
We keep the
Dr.
doctors
Ourian,
know.
thank you so much.
Always good to be
MyFoxLA.com for more information. When we come back, it's a very unusual wedding.
Okay.
It is right out of a Disney cartoon, this wedding that you'll see right after this.
There's the
Before
before.
and
After.
With the candle.
Wow.